I first developed diabetes when I was 21 years old through pregnancy, and it was kind of a scary diagnosis. Didn't really know how to deal with it. My dad was a type 1 diabetic as well. About 5 years ago, I noticed my left foot was really swollen in my shoe. So I decided to go to my podiatrist, Dr. Duke, and she took a look at my foot, did some x-rays, and gave me the diagnosis of Charcot's foot.
Charcot foot is a relatively rare complication of diabetes. Something with the nerves affect the quality of the bone, and seemingly small injuries or no injury at all can cause extensive bone destruction, where essentially bones will fracture or dislocate, and it can leave the foot in a deformed position.
It was so deformed, had ulceration on the bottom, bone coming out at the bottom of my foot. And he said to me that they're going to have to do surgery on my foot. They're going to have to do a foot and ankle reconstruction.
With our limb salvage program here at Loyola, we've been very successful at keeping feet and keeping patients up and walking without needing an amputation.
I think he just made me feel so happy again, thinking, we're going to work on this together. I wanted to do everything he told me to do.
There's lots of surgery options that we can do for a Charcot foot. For Pam, we were able to do a surgery where we put metal on the outside, using rings and metal that all stay outside of her skin, which is strong and takes away the risk of infection.
He said once I put those bones in place, they have to heal in place. He said, so this is going to stay on your foot for 3 months. I went to see him every month while I was in the halo, and he just said to me, he's doing great, looking fabulous, looking great. He'd look at the x-ray and say, I'm really happy with that.
And after the 3 months, we removed the fixator, and she was ready to walk in a boot immediately thereafter.
And I went back to see him after being in the boot for 2 months, and he said, let's get you out of that boot and into some gym shoes.
Wow, you can't even see where that ulcer was, can you?
It's been a huge success, and I'm really happy, and it looks like a normal foot again.
So patients with diabetes require foot care for life. It's really important to get them plugged into a system that can provide that full continuum of care. Our team at Loyola is able to do that. Not just through limb salvage, but through our diabetic foot program, we're able to try to prevent complications from diabetes, and if they happen, we know how to solve the problem as well.
Come on, guys. So I'm 8 months post-surgery, and now I feel like I could take the dogs a walk, I could walk with my grandkids.
She's back running her home health company where she works as a nurse. She's able to travel. Her quality of life is so much better than it was before her surgery.
I can't express enough my gratitude towards that whole team. They just saved my foot. They literally saved my foot.